My name is Dr. Joslyn and today we will be talking about bronchial asthma. Bronchial asthma is a significant public health problem today and 50 to 80% of cases of asthma are evident by the age of 5. We also find asthma very commonly found in senior citizens, especially women above the age of 60 years that have been suffering for many years and have now developed complications like chronic bronchitis, COPDs, and they are unable to carry out their daily work, they are unable to go for a walk, and especially in North India where we see extreme temperatures, where we see drastic or sudden changes in temperatures that tend to affect them. So what is asthma? Asthma is an inflammatory response where the airways in the lungs are inflamed and narrowed because of the body's immune system overreacting to certain environmental agents. A normal lung contains millions of air tubes or airways that are called as bronchi and bronchioles, which bring air in and out of the lungs. Now the airways are lined by a layer of smooth muscle which allows it to constrict and dilate. A healthy airways appears pink and clear with no interior swelling. The muscle bands are not tight and there is no extra production of mucus. The air also flows very freely through the open airways. During asthma, three main changes occur. First is an airway edema or swelling. Second is a bronchospasm, also called as the tightening of the muscles. And third is the excessive mucus production. Now, a trigger or any external allergen will initiate a chain of reaction in the body in order to get rid of the allergen. Now, this is part of the body's normal immune response. Now, after repeated exposure to that same allergen, there is a fixed response by the body. Now, the airways become swollen, red and irritated, leading to a narrowing of the airways, and it becomes difficult for the air to flow through. There is an increased production of mucus which clogs the airways, making it even more smaller and difficult for the air to pass through. Now, simultaneously, there is a tightening of the smooth muscles in the wall of the airways, also called as the bronchospasm, which causes a further narrowing of the airways. Now, the air cannot flow freely through the constricted airways, and this causes the breathlessness and the wheezing during breathing. The classical symptoms that are seen are wheezing, a high-pitched sound that is heard during expiration, a cough that is commonly occurring at night, and difficulty in breathing or shortness of breath. Although wheezing is associated with asthma, remember, not all wheezing is because of asthma and not all asthmatics present with the wheezing. Now you will hear the breath sounds that are heard on auscultation in an asthmatic patient. In the early asthmatic presentation, cough and shortness of breath is often seen with normal breath sounds on auscultation. Now, as the disease progresses and the inflammation becomes worse, the airways begin to narrow, and this leads to a faint wheezing sound which is scattered all over the chest. As the severity progresses, the wheezing can be more prominent, more diffuse, and at a higher pitch. The common triggers of asthma are inflammatory agents like dust, pollen, pet dangers, or air pollution. There can be certain irritant factors in the air like changes of weather, strong odors, cold air, exercise, stress, and smoke. Other factors can also include like food additives, acidic fruits, tobacco, gastric reflux, which is also a very common presentation in younger children, and certain medication in older adults like aspirin, ACE inhibitors, beta blockers, certain painkillers that are often associated with this kind of a cough. In my next video, I will be talking about role of homeopathy in cases of asthma. Thank you.